Thank you. So again, this presentation is for our early retirees and our group Medicare retirees that are looking at the plans to be offered that are not Kaiser specific. So we had a presentation earlier regarding Kaiser. If you're interested in Kaiser or you want to look at rates or have details about the Kaiser plans, please go to the district website and review that presentation and the information that's available there. But today we're focusing during this presentation on the Anthem plans for both early retirees and for our Medicare retirees. So I'll be sharing a brief overview of SISC, what the actions required are to transition to SISC. We'll talk about the early retiree plans as well as the Medicare group plans, the enrollment forms that are needed, what else may be needed, such as eligibility documentation or Medicare, copies of Medicare cards, things like that, the due dates, as well as what's next. And I'll be explaining information about the SISC Direct Bill Retiree Program. So with this, let's go ahead and share who SISC is. So SISC stands for Self-Insured Schools of California, and we are a joint powers of authority, a public entity that's pooling resources from school districts throughout the state of California. Much like CalPERS, it's a pooling resource. But with CalPERS, what happens is they include local public agencies such as police departments, fire departments, municipalities, and school districts. With SISC, we only focus on school district employees and providing benefits to those retirees, or excuse me, active employees and retirees. So we are school focused, and we are the largest risk sharing pool for school focused JPA in the United States. So with that, we are administered by the Kern County Superintendent of Schools or Office of Education. So we're all classified or certificated public school employees, just like the employees of your school district. We were established 45 years ago, and we became the insurance division of the Kern County Office of Education. So we are not an insurance company. We are not a broker-run entity. We are a JPA pooling public schools together to share cost and spread risk over a large population. We are like public schools, so our SISC is subject to the Brown Act, so all of our meetings are open to the public, along with our financial statements. And we are run in the best interest of our membership. So our focus is on the value we provide our members, not the perks, the politics, or the profits. We do insure over 402,000 members, and that's in over 470 school districts throughout the state of California. And 1 out of every 850 Americans is covered by a SISC plan. So you're in good company, whether you're an active employee or retiree of a school district. There are a lot of members within the SISC Health Benefits JPA. So let's talk about general information for our retirees. As a retiree, if you or a member of your family is under the age of 65, you will have the same plans offered to active employees. So the 7 plans include 4 Kaiser plans, an Anthem full network PPO plan, and 2 Anthem HMO plans. And they're actually the exact same plan design. We're just utilizing different networks, and we'll talk about that as I go through the presentation. For our Medicare retirees, so if you are over 65 and eligible for Medicare, and your spouse is also over 65, you have the option of 5 different medical plans to choose from. So as a retiree, a spouse, or domestic partner over the age of 65 or older, you must have Medicare Parts A and B to participate in our programs. And then all of these Medicare cards, you will automatically be enrolled in Medicare Part D. Okay. Medicare eligible retirees have these 5 plans to choose from. So there's the 2 Kaiser plans. There is an Anthem PPO 100% plan. And I'll talk a little bit more about these plans, but this is just a high-level overview. We have a Anthem supplement plan through Companion Care, or actually it's offered through Anthem, but it's a Medicare supplement plan called Companion Care. And then we have our Blue Shield Medicare Advantage plan that is available. So how SISC handles retirees that have somebody under 65 is we leave you in the group Medicare medical plans, excuse me. But the person over 65 must still have their Medicare to pay primary on your claims. So again, we'll talk a little bit about that. Our Medicare retirees, let's focus on them first. So I'm going to go through our Medicare retiree plans first. And then at the end, I'll go through our under 65 medical plans. As I'm suspecting most of you are over 65, please don't be offended. I'm not looking at anyone's pictures. I'm just starting there first. So we have our Senior Advantage plans, excuse me, Medicare Advantage plans that are available. As I mentioned, 2 plans from Kaiser Senior Advantage. We have a $10 and a $25 copay. If you're interested, please review the Kaiser presentation and information that's posted out on the district's website. We have a Blue Shield 65 plus HMO Advantage plan. This is a $20 copayment plan, and members assign their Medicare over to Blue Shield. Okay, so you do not keep your original Medicare Part A and B. You are assigning that over to the carrier, to Blue Shield in this case, or Kaiser in this case. There is no deductible, $20 office visit copays, and automatic enrollment into Medicare Part D. We have a Medicare supplement and coordination and benefits plans. So we have an Anthem PPO plan. It is a full PPO where it offers 100% coverage. Medicare pays primary. The Anthem PPO pays secondary. There is no deductible. Under the Anthem plan, there is no deductible and no office visit copays. Automatic enrollment into Medicare Part D for your prescription drugs. And we give you an employer group waiver plan, or we refer to it as EGWIP plan through Navitus Medicare RX. And this is a $0 copay for generics and a $20 copay for brand. We have a Companion Care Medicare supplemental plan. So again, you're using your original Medicare, Parts A and B, and then your Companion Care will come in and pay secondary to Medicare after Medicare pays. So there is no deductible on this plan, no office visit copays. The plan pays on all Medicare allowable expenses. So I'll go into a little bit more detail about the difference between these two in the next couple slides. And then we do automatic enrollment into Medicare Part D and give you a Navitus Medicare RX plan that has $9 for generic and $35 for brand. So these are the different types of plans that are offered: 2 Kaiser, 1 Shield Advantage plan, Medicare COB plan with Anthem PPO, and then a Medicare supplement plan. Okay. So in the information that was posted to the district website, you may have seen this side-by-side plan comparison. Now, this is just a high-level comparison of what the member may pay if they're enrolled in each one of these plans. So the first is the Anthem PPO, the Anthem Companion Care, your 2 Kaiser Senior Advantage, and your Blue Shield Advantage plan. As you can see, going through these plans, assigning your Medicare, keeping your original Medicare. If you stay in network, you're going to have no member out-of-pocket expense. So you can take a look at that side-by-side comparison. I'm not going to go line by line, page by page. The district has posted this side-by-side comparison, as well as the benefit summaries for each plan and the evidence of coverage for each plan. So you can take a look at it and see if, which plan best fits your needs. So the Blue Shield 65 Plus Advantage plan, it is an Advantage HMO plan, which requires you to have continuous enrollment in Medicare A and B. They will automatically enroll you in Medicare Part D, and you assign your Medicare over to Blue Shield HMO. So it's really important that you want to check to make sure your providers are in the Blue Shield network. And that within the enrollment information, there is a link that will take you to the Blue Shield website that allows you to look up the providers that are contracting in the Blue Shield network. You cannot use your Medicare for non-Blue Shield providers when enrolled with a Blue Shield 65 Plus plan. So through the Blue Shield Advantage plan, you will be picking a primary care physician, and that physician, because it's an HMO, will be managing your health care. Now, keep in mind, SISC only offers California-based plans. So if you are currently in an Advantage plan or other type of plan because you are outside the state of California, the Advantage plans will not work for you. Okay, so you will be looking at the Companion Care Medicare Supplement or the Anthem PPO plan. So on this Blue Shield Advantage HMO plan, if you are traveling, you are covered worldwide for only emergency and emergent care or urgent care services. The reference to Costco Zero Pay program, that refers more to transitioning from an active plan to a retiree plan, so don't worry about that. The generics are a $20 copay, and preferred $60 copay, non-preferred $100 copay for up to a 90-day supply. And the Blue Shield PPO members are enrolled in the Medicare Part D prescription drug plan administered by Blue Shield of California. And of course, with these group plans, one of the reasons why you choose to stay in a group health plan is currently you have no gap in coverage for your prescription drugs. So there is no donut hole on these plans. My understanding is in the future that donut hole will be going away, but it is an important component for your plans today. So companion care, let's talk about that plan. This is a different type of plan. It's a Medicare supplemental plan that's administered by Anthem Blue Cross for SISC. So members will keep their original Medicare. You're not assigning it like you would in an Advantage plan. You're showing your providers your original Medicare plan, your original Medicare ID card, and they're billing Medicare under Part A or Part B. So the cost will not increase according to the member's age, because out there on supplemental plans, sometimes they do that. Our plan does not. and the premiums may be subject to yearly increases with those age bands. We don't do that. Okay, our companion care does not increase in premium. It stays the same through the contract period. Members enrolled in the Medicare supplemental plan will maintain that original Medicare, and members self-referred to any U.S. provider that accepts Medicare assignment. So it's really important that you find out if your doctors are on Medicare's provider list, meaning that they accept Medicare assignment. The member's cost share is $0 when medical services are both approved by Medicare and provided by providers that accept Medicare assignment. Okay, so that's a question you're going to want to, double check with your providers or look it up at medicare.gov. So at medicare.gov, in the upper right-hand corner, there's a tab that says Providers and Services. And if you click on that, you can find providers that are contracting through Medicare. Okay, and that means they're accepting Medicare assignment. On this plan, if Medicare does not cover a service, then companion care will not cover the service, except for some limited travel coverage that's available. Okay, so keep that in mind. Services beyond Medicare and Medicare allowable will not be covered on this plan. And members must reside within the United States. Okay, so if you're thinking of moving to another country, this plan would not be for you because you are using Medicare as your primary insurance. For the prescription drugs, as I mentioned, we will enroll you in Medicare Part D and provide you with a Navitus Medicare RX plan, $9 for generic, $35 for brand and specialty. And there is no coverage gap, again, on this, or a donut hole that you would see with Medicare Part D plans on the individual market. And again, our Anthem PPO plan is available. It is a coordination of benefits between Medicare and Anthem. So again, you are going to want to stay enrolled in your Medicare Part A and B. That means paying your Part B premiums as you're doing today. And remain enrolled. Medicare will be your primary insurance, and that's what you're going to show to your providers. And then members can self-refer to any Anthem PPO network provider for your secondary coverage through Anthem. If the Medicare service is not covered by Medicare, then it may be covered under your Anthem PPO plan. Just depends on the type of service. So see your benefit summaries, or your benefit summary that's provided for this plan for covered services. I will give you an example. Medicare does not cover routine preventative visits. So under this plan, the PPO plan will cover. Okay, so you'll have coverage for routine preventative. On the companion care plan, you will not, because it only pays on Medicare allowable services. So this plan, if it's not covered by Medicare, it will not be covered by companion care. This plan, if it's not covered by Medicare, but is covered by your PPO plan, then you still have coverage. Okay, so the medical plan is administered through Anthem Blue Cross. There is no deductible for the PPO plan, so it's 100% coverage. As long as you're staying in network with the Anthem PPO provider. The member's medical cost share is zero, or the defined copay, such as ambulance, there's an ambulance copay. When the medical service is both in network and covered under the PPO plan as a covered benefit, okay? Navitus Medicare RX Part D prescription drug plan is 0 for generics, 20 for brand or specialty. And again, there's no donut hole when we enroll you in Medicare Part D. So this is just a brief overview of in-network services for each of these plans. And we're going to refer you to your benefit summaries for definitions, limitations, and exclusions for any of the plans. On our companion care, and I'll pause for questions in just a moment, any that's not being answered in the plan. For our companion care and our Anthem PPO group Medicare plans, SISC carves out the prescription drug benefits. You've heard me refer to the Navitus Medicare RX plans. Our pharmacy benefit manager is Navitus. So Anthem will not be who your pharmacy bills for outpatient prescription drugs. It's going to be Navitus. So the network includes most independent pharmacies and all major chain pharmacies under the Medicare RX plan. Specialty medications, and if you're on a if you're on a specialty medication, you know what that means. It's typically injectables, you know, MS, cancer medications, different things like that. That falls under Navitus Specialty RX. And Navitus contracts with specific pharmacies. And so once you receive your ID card, you're going to want to contact Navitus to get the details on who will be providing your prescriptions, whether it, you know, for the specialty RX. The Navitus formulary, you know, when determining how drugs are covered, Navitus pharmacists and physicians evaluate the therapeutic value, effectiveness, and side effects to determine medications that are on the formulary. All of the medications that are on the formulary are CMS approved, or Centers for Medicare and Medicaid Services. They are, Navitus offers a CMS approved formulary. So it's not our commercial formulary or anything like that. It's CMS approved. So sometimes Navitus adds medications or removes medications. And if that's going to happen, you'll be notified, and they'll always be sure that a high quality, safe, and effective alternative is available to you. Some covered medications require step therapy or prior authorization, and some therapeutic classes have preferred medications. So you'll want to, after you receive your ID card, you can register as a Navitus member and take a look at that formulary and what it is, or you can call the ID card or the customer care number on your ID card to talk to them about what your copays may be, or if there is a prior auth or anything that's needed. And keep in mind, we're only talking about Anthem PPO and the companion care Medicare supplemental plan that has Navitus attached. If you are with the Blue Shield HMO 65 plus plan, then you're using the Blue Shield network associated with them, and their prescription formulary and information is available in the documents that, or a link in the documents that were provided. Filling a prescription, just so you know, at your local pharmacy, your prescriptions that you have on file should be still valid if you have refills. You're just going to want to tell the pharmacy that as of January 1, you have a new pharmacy benefit manager, and you're going to want to give them the information from your Navitus ID card. So the BIN number, the PCN number, the group number, and they'll run the claim through Navitus rather than any other coverage that you may have had prior to January 1. If you are one that likes to use mail order and have the prescriptions delivered directly to your home, you will need to obtain a new prescription from your doctor that has up to a 90-day supply, and that's going to go through Costco mail order. So Costco is kind of our preferred pharmacy. You are not required to use Costco for your retail or your mail order, but mail order prescriptions are the only place you can get mail order. I misspoke. For your retail prescriptions, you can go to any pharmacy, but for mail order, you have to go through Costco mail order. Sorry about that. Okay, so when you get your ID card, you're going to have a telephone number on there for Navitus RX. If you're currently taking medications, you're going to want to call that number and find out if your medications are covered on the formulary. If you want, you can go to navitus.com and register as a member after calling Navitus to get your personal ID number. And then you can view the formulary, the medication history, your copays, all that good information is available out there online. So always call Navitus for assistance with anything to do with your prescription drugs if you're on the Anthem PPO or the companion care plan. Okay, this is the rates. And before I go on, I'm going to stop and ask if there's any unanswered questions. Bobby, do you have any unanswered questions that I need to fill in? Oh, I can't hear you, Bobby. You're muted. Let me find you and unmute you.
I think I'm unmuted.
There you are.
Can you? Hi. Yeah, I do have a couple of questions I want us to go back and address real quick.
Sure.
If you could go back and address how preventative care and companion care work together and what is and is not considered preventative care so that there's not some confusion on, yeah, you know how that confusion goes.
Yes, so sure. So when we refer to industry standard routine preventative, this is typically an annual exam and certain blood work that falls under routine preventative. And it does not have a diagnosis associated with it for an ailment or an injury, an illness, something along those lines. If you go out to Medicare.gov and click on providers and services, they do have a little button, a link that you can say not covered, or it says not covered. And if you click on it, it'll tell you the items that are not covered by Medicare. Those items that are not covered by Medicare will not be covered by companion care. And one of those is a routine preventative exam. So Medicare doesn't cover that. And in that case, companion care will not cover it. Okay, companion care only covers services that are Medicare allowable and from a provider that accepts Medicare assignment. Okay, so that's one item that you may see different in the plans that you have offered now, because this truly is a supplement to Medicare. Okay, but on the Anthem PPO plan, it pays for Medicare allowable expenses as well as items that are covered by the PPO plan. And under the PPO plans, they do cover routine preventative. So that's just an example. Do you have another question, Bobby?
Yeah, I think this would be a good time to address also what it means to be in network with Medicare.
Okay, so in network with Medicare means that that provider of service, whether it be a doctor, a lab, imaging, those providers have contracted with Medicare and have agreed to accept Medicare's reimbursement or Medicare's payment for that service. Okay, so that means in network. Anytime you hear us say in network or contracting provider, that means they have literally contracted with that provider to accept those fees. Okay. Now, throughout the state of California, there are some doctors that do not contract with Medicare. And if your provider does not contract with Medicare or accept Medicare assignment meaning accepting what that provider bills, what Medicare pays for that service, they want to bill what they want to bill, which could be more. That would be considered like out of network. Then companion care is not the plan for you because there will be no coverage. You will be paying that provider of service, that doctor's office, whatever they want to bill. Okay. Next, Bobby.
And then one last item here. We do have some members on the phone who are outside of the state of California. And so just questions about how this coordinates with, for example, Blue Cross in Georgia or any other state for companion care.
Okay, so for both companion care and the Anthem PPO plan, you are keeping your original Medicare. So that is good anywhere in the United States from any provider that accepts Medicare. That's your primary. And so you don't have to worry about the in California or out of California if you are enrolling in companion care or PPO. It is actually the Advantage plans where you're assigning your Medicare over to Kaiser or to Blue Shield HMO. Those you have to live within California and you have to live within the service area. But you do not, again, have to live in a service area if you live in the United States and you're using your original Medicare for companion care and the Anthem PPO. Okay. So let's go ahead and, oh, I'm sorry, one more?
Nope, I was just going to tell you to go forward. That was good for now. Thank you.
Thanks, Bobby. Okay, and so here are the rates that are available for our Medicare plans. So no Kaiser is included here. We do have the Kaiser rates in the Kaiser presentation. These rates are effective January 1st of 2025 through September 30th of 2025. And the reason for that is our renewal with SISC, the SISC JPA or SISC Health Benefits JPA, we renew every October 1st, 2025. Every October 1st. So these rates could change effective October 1st of next year and each October 1st thereafter. So CalPERS renewals January 1, SISC's renewal is October 1. Okay, so each of these plans are for our retirees over 65. So if you're single, you have the single rate for each of the plans. If there are two of you, both over 65 with Medicare, then this would be the rate for a two-party contract with companion care, Anthem PPO, or the Blue Shield Plus HMO Medicare Advantage plan. So this just reiterates that all persons over 65 must have Medicare A and B. If the retiree spouse, domestic partner, or a dependent child is under 65, the retiree and your family will remain on the early retiree plans and rates. So I'm going to talk about those in just a moment. Now, before we leave our Medicare retirees, I want to let you know what we need from all retirees. And in a moment, I'll go into the under 65 plans. So bear with me. But for all retirees, we must have you complete an enrollment form. There will be no transfer of anything. I mean, literally anything from CalPERS over to SISC. So we have to have you complete, choose a plan and complete the applicable enrollment form for the plan you want to enroll. You need to be sure that you fill in full social security numbers, names, dates of birth, and your email address if you have one. So we have that information. We need to get it all and get it into the SISC eligibility system so we can transmit it over to the carriers and get your enrollment in place prior to January 1. Be sure to sign and date your enrollment form. You have instructions out there on how to fill out your enrollment forms. There is a question about the PPO companion care enrollment form that I want to address in just a moment. But we want to be sure that you complete the form with all the information that's needed. If you have a spouse, a domestic partner, or a dependent, we're going to require dependent eligibility documentation because we need to get you into our system and we need to know that you have, your dependents are valid and they meet our requirements for eligibility. So I'll talk about that on the next slide. That's what dependent documents are needed. We want to be sure to let the district know which plan you're enrolling in. So for our retirees under 65, you're going to do a plan election form, which I'll share that in a moment. For our Medicare retirees and those with dependents who will be enrolling, we need an enrollment form for each person. So for both you because you have Medicare and from your spouse or domestic partner because they have Medicare. So the Blue Shield 65 Plus, the Kaiser Senior Advantage, and companion care, each person with Medicare must complete a separate application. And actually, this should say Anthem PPO as well for the application process. You're going to return your enrollment form and any additional documentation to the district office in San Jose, okay, on Ryder Park Drive. So those of you with dependents, whether you're over 65 or under 65, if you're adding a spouse, SISC requires the first page of your federal tax return. So this would be for 2023. That's the last time we all filed taxes. And this should show for our couples, married filing jointly or married filing separately. You can redact the financial information because we don't need to know that. SISC does not need to know that and the district doesn't. So you can just black out the financial information. We just need to see, married filing jointly, married filing separately, and that spouse listed. If for some reason, as a retiree, you don't file a joint tax return, contact the SISC office or work through the school district to see if you qualify for submitting a marriage affidavit. It's used in unique situations, but we can provide that and the affidavit along with your marriage certificate. We can get your spouse enrolled. If you're newly married, congratulations. And if it's been within the last year, you probably haven't filed taxes together, so we will accept a marriage certificate. So it's based on the date that you got married. For our domestic partners, we need a certificate of registered domestic partnership issued by the state of California. We started requiring that document once Assembly Bill 205 went into effect. If you do have dependent children, so whether it be a natural child, a stepchild, or adopted child, they're eligible to be on your plan up until the age of 26. We need a legal birth certificate with both parents' name and a child's full name and birth date on it. If you've adopted a child, then we need the legal adoption documents. If you have legal guardianship of a child under the age of 18 and you have the legal court documents establishing the guardianship, that child can be covered under the plan. And then if you have a disabled dependent over the age of 26, we need a couple more things. So we need the legal birth certificate. We need a prior year's tax return. So this would be 2023, showing a child is claimed as an IRS dependent. That's something that we require. And then proof of 6 months prior credible coverage. So if they've been covered under your plan for the last 6 months under CalPERS, that's, proof of that is all that we need. And then completed, in this case, it would be an Anthem disabled dependent certification form. So if you need that form, we can send it to you and you would take it to your provider. Unless you're on Anthem now and they have already certified the dependent for ongoing beyond January 1st, if you have a copy of that letter, we can accept that as well. So I'm gonna just stop really quick to see if there's any additional questions with any of that. Any questions?
I think we've been addressing everything so far. So
thank you. Very much appreciated. Thank you. Okay. So let's talk about SISC Direct Bill Retiree Program. All retirees of the Berryessa Union School District that are continuing on with benefits after they retire will be part of the SISC Direct Bill Retiree Program effective January 1st, 2025. And SISC will be billing all retirees for their medical benefits. Now, the reason is we cannot pull your premium from your pension check. Whether you're CalPERS or CalSTRS, we cannot pull that premium out of your pension. So once you turn in all your enrollment forms and in your copies of your Medicare cards, things that are needed that are outlined in the instructions for enrollment, those are all due to your school district no later than October 25th. The district will forward all that information to SISC. We will download you into our eligibility system, transmit to the carriers. So Anthem, Kaiser, Blue Shield. And then we will enter you into our direct bill retiree program, which will generate a letter to you. It's a welcome letter. It should come out to you in early December, confirming your enrollment, your premiums that are due, and our payment options. We have a couple different payment options. We do not do credit card payments, unfortunately, but we do have other payments. So within the letter, you'll get coupons that you can cut and send in with a check to SISC, or you can go to our online portal and set up to make a one-time payment or reoccurring payments. You can go to your bank and have your bank set up automatic payments to SISC, or I believe we can withdraw the premium payment. So it'll be outlined in your welcome letter, again, that you should receive in early December. I would say by December 10th, you should have that letter out to you. Now, after you're enrolled and you receive your ID cards, that's when you know that the carriers have you in their eligibility system, so you can start asking them benefit questions, calling the member service number. But if you have any questions about your direct bill retiree program and making payments, you can email us at siscretirees@sisschools.org, or you can call our main health line at 661-636-4410 and ask for the direct bill program. Okay. Again, you're in your open enrollment period. Everything's due by October 25th, and the new SISC benefits will start January 1st, 2025. So your completed enrollment forms with all the fields filled in and signed, along with your dependent documentation, copies of Medicare cards, that's all due to the HR department. If you have more questions, you can come to one of our on-site meetings in October that we're having out on the website. It has those dates and locations of where we will be. We have a couple district office locations, as well as at the middle schools. The next open enrollment period for plan changes will be effective October 1st, 2025. If you decide you want to change your plan, Medicare plans require 45-day advance enrollment or plan change requests due to the Centers of Medicare and Medicaid's approval process. And I will tell you that anytime you choose to terminate coverage with SISC, go out to an individual retiree plan or another plan outside of SISC, you can never come back to the SISC program. Okay. So you are subject, to stay within the program. So for our Medicare retirees, before I go on to our early retirees, is there any questions at this moment that are outstanding?
Not regarding the plans themselves, Lori. It looks like Ricardo and Bettina are working with members regarding how to get paperwork to you, but you
Excellent.
go on.
Okay, so let's talk about our early retirees. So with SISC, it's a little bit different for our retirees. The next few slides are referring to retirees who themselves are under 65, or they have a dependent or a spouse that are under 65. So for those retirees, there are 7 plans that are available. Today, I'm only talking, or during this presentation, I'm only talking about the non-Kaiser plans. So there is an Anthem PPO plan, and I'll go a little bit of detail in that, but it is a 90% coverage plan. We have an Anthem HMO plan, and it's available with the full HMO network and the select HMO network. And so we'll talk about that. Again, these are just brief highlights of in-network services. The details are available in the side-by-side comparison that has been posted. The benefit summary as well as the summary booklet or evidence of coverage booklets. Those are available to you out on the district website. Also, as a reminder, it's always the patient's responsibility to confirm benefits and verify if your provider or the hospitals are in network or contracting for the plans you elect. So when you elect a plan, you want to make sure your providers are in there unless you're willing to make changes in, your primary care doctors or your specialist. Out-of-network services may not be covered. If you enroll in an HMO, you can't go out of network at all. You stay within the HMO network. Under the PPO, you can go out of network for some services, but some services are not covered if you go out of network. So you want to pay close attention to that. So again, we'll start with the Anthem HMO plans. So the HMO plan that is available is an Anthem Premier $10 plan is what we call it. So your office visits, urgent care and specialists are at a $10 copayment and there's no deductible. This is an HMO plan. The emergency room copay and ambulance copay is $100. Out-of-pocket maximum is $1,000 per individual. So high level, very high level on the Anthem Premier PPO plan. You have the choice between two networks that you can choose from. So the Anthem HMO full network, this is Anthem's largest network of contracting providers in their HMO network. And then they have the Anthem Select HMO network, which is a little bit of a smaller network. It may not include some of the larger medical groups that, for instance, Palo Alto Medical Foundation will be in the full network, but it won't be in the Select network. So be sure that your providers are in the network in which you choose. Again, with our Anthem HMO plans, the prescription drug coverage is through Navitus Health Solutions, not Anthem. So on our plan, there's $5 generic, $20 brand name drugs. If you go to Costco, there's a zero copay. Okay, so you don't have to pay any copay on most generics at Costco mail order or retail. The Costco mail order service, you can get prescriptions up to a 90-day supply for $0 to $50, depending on if you're getting brand or generic. The Anthem HMOs require you to choose a primary care physician for each person enrolled. So you must provide that primary care physician enrollment ID number on your enrollment form. Otherwise, Anthem will assign you a primary care physician. And if there's somebody particular that you're seeing today and you want to stay with that provider, you're going to want to make sure you put this ID number on your enrollment form. Now, to view or to find the ID or which providers are in the network, the district has posted the Anthem HMO directories on their website. So there's an HMO, Anthem HMO full network and an Anthem Select HMO network available. Or you can go to Anthem's website and click on Find Care, choose your network, and then select your location. So maybe you moved out of the Bay area or Santa Clara area and you moved down south and you want to know, who the contracting providers are in the Anthem HMO network. You can go out to anthem.com/California or CA/SISC. This is our microsite, and it will take you to the website and allow you to find a contracting provider in your region within California. So again, benefit summaries and evidence of coverage booklets for the details, limitations, and exclusions are also posted out there. For another option for our retirees under 65 or our active employees, we have an Anthem PPO 90% plan. Okay, our Medicare retirees that are enrolled in the Anthem PPO 100, that's a 100% plan that pays secondary to their Medicare. For our retirees that are under 65, it's a 90% plan. So it's $20 office visit, copay, urgent care, and specialist. The first 3 visits at the primary care provider's office are at a 0 copay. So our PPOs, we're encouraging you to go to primary care. And so there's no copay. There's a $500 individual deductible. And then once that deductible is satisfied, the plan will pay 90%. You pay 10% coinsurance. And the maximum out of pocket per individual is $1,000. So once you hit $1,000 between your deductible, your 10% and your $20 office visit copays, the plan will kick in and pay 100% for the rest of the calendar year. This also has the Navitus Health Solutions prescription drug coverage, $5 generic, $20 for brand. Mail order is available, and your most generics at Costco are at a 0 copay. So services from out-of-network or non-Anthem PPO contracting providers will be limited or not covered at all. So again, it's your responsibility to know your benefits. I always suggest calling the customer service number, the member service number, the customer care number that's on your ID card to confirm benefits. The Anthem PPO plans do not cover services provided by non-contracting provider for routine physicals. This is if you don't go to an Anthem contracted provider. So routine physicals, X-ray, imaging, laboratory, durable medical equipment, and physical medicine. You want to make sure you're going to an Anthem PPO contracting provider. Inpatient hospital services must be prior authorized. Outpatient hospital coverage has limits. So look at your benefit summaries. Contact Anthem to be sure. There is an Anthem PPO directory for South Bay and Santa Clara County that is posted to the posted to the Berryessa Union School District website. Or you can again visit anthem.com/CA/SISC and click on Find Care. And then for the PPO plan, you're clicking on PPO, put in your location, and it'll give you a list of providers that are contracting. With the PPO, you do have the freedom to go to whichever provider you want. You don't have to list one primary care physician to manage your health care like you would on an HMO plan. Okay. Again, this is the same information I mentioned before. Our active and early retirees, the outpatient prescriptions for those Anthem HMO and PPO plans is through Navitus Health Solutions. So that's our pharmacy benefit manager. So your prescriptions will not be covered under Anthem. They're covered under Navitus. So that information will appear on your ID card. We have a combined card for our Anthem HMO and PPO members that has the Anthem information included, as well as the Navitus prescription drugs. With our active plans, you can use any network pharmacy, most independent and all major chain pharmacies except Walgreens. The SISC Navitus prescription drug program does not contract with Walgreens. Okay, so if you have a prescription with Walgreens, you're going to want to transfer it to another pharmacy. And again, Navitus has their own formulary of medications. They do some medications require step therapy and prior authorization. And SISC prescription drug plans do not have coordination of benefits. So keep that in mind. There's coordination of benefits on the medical side, under Anthem, but not through the prescription drugs. So we typically recommend that you use the pharmacy benefit that's most advantageous to you. So the one with the lowest copay, if you can. I highly recommend anytime somebody enrolls in one of our programs that has Navitus Health Solutions as their outpatient prescription drug coverage, that once you get your ID card, go to navitus.com/members and register. Be sure to register as a member. You have access to your medical history, drug interaction, prescription drugs, most importantly, the formulary to see if your medication is covered under the SISC plan or under Navitus, and whether or not it requires a prior authorization or step therapy. So always be sure to call Navitus for assistance. They have a customer care line that's available 24/7. If you call now, they're not going to know who you are. So you need to wait until you receive your ID card before you start calling to ask if your medications are covered or not. And don't wait till the last minute. Don't wait till January 1 to start calling if you need to fill a prescription, because they may need to work with your doctor on a prior authorization or history if there's step therapy available. Let me just pause for a second to find out if there's any questions about the medical plans for retirees who have someone under the age of 65 on their program. Anything, Bobby?
I don't see any questions regarding the medical plans at this point.
Okay, good. Moving forward, these are the rates for retirees, early retirees where someone is under 65 is enrolled. The family goes on the under 65 rates. So here we have the Anthem PPO, the single, the two-party, and the family rate. We have the Anthem HMO full network. Rates a little bit more than the select network, a little bit less. And keep in mind, anyone who's enrolled, the retiree, the spouse or domestic partner who is over age 65, must have Medicare Parts A and B and provide copies of those Medicare cards to SISC. Your Kaiser members under 65, they'll have an associated Kaiser Senior Advantage plan that goes along with these plans. But today we're talking about our Anthem plans. So these are for retirees under 65, as long as somebody on the contract is under 65. Same next steps and due dates. You have until October 25th to make your decision, complete all your enrollment forms and get them in. Please do not wait till the last minute. If you know what plan you want, if you have your documents, turn them in to the HR department. They're collecting a lot of enrollment forms and they're having to process them and code them with the right group numbers and things like that. If everybody waits till the 25th, they're going to have a tremendous amount of burden on them. So please turn them in as soon as you have them and they're ready to go. Make sure all the fields are complete. You have those copies of what you need and you turn it in as one complete package to the Human Resources Department in San Jose. And here's the address. Again, your next open enrollment is effective October 25th. So 45 days prior to that, our direct bill retiree program will send out information to you, letting you know it's open enrollment. And here is your new rates, October 1. And if you're interested in seeing other options, to contact that direct bill retiree program. So a lot of information has been shared. I am going to check to see, I see a couple questions here. If it's related to CalPERS and when they're going to stop premiums, or when do they take the last premium out, that is something that will probably have to be confirmed with CalPERS. If it has to do with, whether you have contributions by the district can answer that, or they may have already answered that for you. If it's specifics regarding the SISC plans, and maybe you want to know if something's covered, but you definitely don't want to do PHI out here on to the chat feature, and you have more detailed questions, you can either go through the district and they'll connect you to us, or reach out to SISC and we can hopefully answer some of those questions. Okay. I thank you for joining us today. I hope the information that has been provided to the district as far as instructions and benefit summaries and all that have been helpful to you in helping you to make the decision on which plan you would like to enroll with SISC for January 1. Again, if you do choose to leave school district coverage or the SISC coverage January 1, just keep in mind on the medical piece, you will not be able to come back to SISC at a later date. Okay, that's part of our rules and our underwriting guidelines. Okay, so
Lori, I did want to mention or remind everyone that the on-site open enrollment will be on Wednesday and Thursday of this week from 8:30 to 4:30. You can come into the district to get some other questions answered and also get help with your enrollment forms. So please stop by between those times. And also a recording and a copy of the slides for this presentation will be on our website by tomorrow.
So thank you, Bettina. I'm sorry.
Awesome.
So, again, if you do have additional questions, you can stop by one of the meeting dates that are posted out on the district's website to meet with a SISC rep or a Kaiser rep, or ask questions and turn in your forms. Okay, and keep in mind, we only need copies, not originals. So if you could bring copies, that would be great to be submitted with your enrollment form. Okay, thank you very much, and have a great day.